welcome in. We're just gonna be right back this way. We'll be down this hallway here. And we're gonna be right in this room here for your preoperative visit with Dr. Simon or Jen. So today we're just gonna go over your current medications and all your allergies, all your current symptoms, and we're gonna review your labs, EKG, medical clearance, make sure you're all good to go for surgery.
This is a model of a knee replacement. It's made out of titanium and there's a hard plastic that lasts for millions of cycles. The plastic was the weak link in the old days. The past 10 years, the plastic has been remade, so it will probably last your lifetime. We shape the femur by using different techniques. All we're trying to do is remove the damaged cartilage that's worn out and replace it with a piece of metal. We shape it and then we impact the metal on it in place. And we can put that in place with either cement or many times now it grows into the bone. The tibia is prepared by cutting the surface and punching a segment into the bone. And again, the tibia is put back into place and held together either with cement or more recently now the bone grows into the implant. The white part is the hard plastic that we think is going to last forever and was the weak link. A surgery can be done, we do this as an outpatient. It is well tolerated and you're walking on the same day as surgery. Usually you use a walker for 2 to 3 days and get rid of it by the end of the week. We can do that with CT guidance, MRI guidance, robotic. There's even models that we make that's patient specific for your knee. That way the precision for the implant is more exact. If we don't have the exact implant, the implant is not made specifically for your knee, but we have about 50 sizes available. There's about 8 sizes on your femur, and then we have a medium as well as a narrow, and again on the tibia. You put all the combinations together and there's 50 different sizes for your knee. And let's meet our friendly staff at Posada Ambulatory Surgery Center.
Good morning. Good morning. Welcome to Posada. I'm Anna. This is Kim.
They'll be taking care of you. They'll be asking you certain questions and making sure that your medical history is current. They're going to want to know your medications, your surgical history. They're going to tell you to wear loose clothing, bring your medicines with you, and be knowledgeable about your health history. Then they will have you fill out some forms and consents, as every place would. You'll have a seat behind you, and then wait for one of the nurses to bring you back.
And also, if you're having a total, you probably want to bring your walker or crutches with you.
A total means a joint replacement, such as a hip or knee replacement.
And be sure to have the name and phone number of your driver.
Yes.
And bring a smile on your face.
Well, my name's Becca. I'm going to be one of the nurses taking care of you today. This is where I will confirm your name, date of birth, and what we're operating on. And we just want to make sure we're on the same page on the side that we're operating on too. And then when we get through these doors, there's a chance to use the bathroom if you need to. I'm also going to confirm when your last food and fluid intake is. And hopefully you will say the night before and that you took your medication, any medications you took this morning too. And then this is where we are going to be today. There's 3 different bays. This is the pre-op area, but this is where you'll be today. You're gonna sign 2 forms for us when we get here. You're gonna sign surgery consent, and you're also gonna sign anesthesia consent. You are going to see 3 different people before you head back into the operating room. You're going to see Dr. Sima, where he's going to mark the correct knee or hip or shoulder, whatever you're operating on, he will mark it. And then you'll also see the anesthesiologist. So if any questions regarding anything, they'd be happy to answer. You're also going to see an operating room nurse who's going to be in the room with you. And then you'll get dressed into a robe. So you'll come on the other side, and we'll give you privacy, but this will go right over. You're going to be in it. We take everything off, okay? And this is going to be open to the back and over the head. You get a belongings bag. You get a party hat, and you'll ultimately get some socks and your leg compressions. Once you're done with surgery, we go over to the recovery room, and then after you get dressed and all ready, we will shave if we need to, or clean, and we'll clean the area with. I will show you. With this little scrubby. It kind of looks like an orange bad spray tan. It's the first scrub. They'll scrub you really well back there too, but this is just the first cleaning.
And they'll bring this bag to the
Yes, everything's going to go under your bed so we won't lose it, and everything will be labeled too. So you'll make sure to take jewelry off, and if you forget to take it off, and if you have glasses, we have lots of things like envelopes we can put them in with your label. And then, yeah, and you'll also get an IV here too. Okay, and then once you're all set and ready, then they'll roll you back into the operating room, and they'll do your surgery back there, and then whenever you're ready, the anesthesiologist and your operating room nurse will bring you into the recovery. This is where the anesthesiologist will do your nerve block, okay? And Dr. Sima will explain what that will all look like, as well as the anesthesiologist. But this is where it will happen, and then after that, they'll roll you back into the operating room.
All right, coming out of the OR, you'll be wheeled back into PACU, which is our recovery area. So you'll be wheeled back into a bay that looks just like this. We'll hook you up to our monitors and get you set up to kind of sit and recover from the anesthesia. This is also where we'll do your nerve block for a total knee. You'll be pretty sleepy when you come out of the OR, so most patients don't remember it, but this is where we do it. If you have a total hip done, you'll also wake up with a drain usually. So we'll monitor your drain, we'll monitor your vitals and pain, and get your compression stockings put on, and wait for the spinal anesthetic to wear off. It takes 2 to 3 hours for it to wear off. We will always recommend bringing something to entertain yourself for those couple hours, because you'll be awake but without feeling in your lower legs. So the spinal wears off from the toes upwards. So we'll be checking your sensation in your toes, checking your calves and your knees, and then the last area to have sensation come back is your glutes. So once you can squeeze your glutes together, then we'll start moving you around and have you sit at the edge of the bed, and then we'll get our physical therapist to come evaluate you. Once they've evaluated you, they'll check your sensation, make sure that you're safe to stand, walk you to the bathroom, and then once everything's clear, you'll be able to go home as long as your vitals are stable and pain is well controlled, and then you'll be able to walk out.